You're listening to the Patient Advocacy Now podcast, presented by Greater National Advocates.
It's just gut-wrenching sometimes. Like, if it's sad and they're crying, I might cry.
Amazing how many doctors do not even want to treat somebody who has Medicaid.
Medical system is about making money.
And I said, so are you hiring more nurses, or you're just telling each nurse to work harder?
Karen Mercereau, thank you so much for being on the Patient Advocacy Now podcast. I'm really excited to talk to you because you are a pioneer. You're one of the trailblazers in this space, if not the trailblazer. And a lot of people who listen to this podcast still aren't really familiar with how advocacy started in this country, what it entails. And obviously there's different splinters where it's kind of gone off and been different things. Tell us your story. How did you come about bringing it to this country? What was your role? What are you continuing to kind of give us the kit and caboodle of your story of how it started?
Well, thank you for this opportunity, John. After 34 years, a clinical nurse, I graduated in 1968. And after 34 years in every type of ICU, I decided to do something different. I was working pediatric ICU, and I quit my job because I had been tracking the downhill spiral in healthcare system in the country. And I decided that somebody needed to do something. And in fact, thought that people need somebody like me to advocate on their behalf, guide them through the system, teach them how to work with their docs, etc., and educate them. So I thought somebody must have thought of this ahead of me, and they can teach me, and wouldn't that be wonderful? No. Back in 2002, patient advocacy was not even a topic. So
Can we take a quick pause just for a sec? You said something that I think needs a little further elucidation. When you talk about a downward spiral in the healthcare system, tell me more about that. What were you seeing that was so alarming?
Well, Johns Hopkins pointed out that medical errors were the third leading cause of death. The level of health literacy in the United States was, according to a national study from the National Academy of Adult Learning, was 12%. A few years later, the National Academy of Medicine published a study demonstrating 12 million misdiagnoses a year at the cost of $750 billion. Hundreds of thousands of people were going to the ER because of pharmaceutical error.
So it was a litany of things that was just, it was
and on. And
patient education, medical error, misdiagnosis, pharmaceutical mishaps, just a lot of problems.
So it was time to do something. And nobody was doing anything about it. I looked all over the country looking for a partner. There was none. And I am a cliff jumper. And I thought, I'm just going to do it. Of course, I knew what had to be done, but I didn't know how to do it. So Here's what I did. I put up my first baby website and got replies from the planet. From the Middle East, from Europe, from Canada, and of course from all over the U.S. And I decided to work just in the U.S., that's my country. And I spent 7 years working with clients all across the United States to design the RN patient advocacy process, which stands alone. There's absolutely nothing like it. You can't just sit in a room and make this up. It has to be based on actual practice. And so at the end of 7 years, so many nurses, I knew I would eventually teach. So nurses had written, teach. I put on my first beta test course in September of 2009 down in Orlando. And a couple of weeks later, I was speaking with Dr. Joan Shaver, the Dean of the College of Nursing at the University of Arizona at that time. And she said, would you please come in here and tell us what you're doing? Okay. So I went into her conference room, which was filled with RN PhDs.
To open
I am
Pandora's
not
box,
academic. I am clinical. There's a big difference. All right.
Okay.
So I gave him, the room was silent. And there I sat. 2.5 hours. I gave him chapter and verse. Silence. At the end of that, the dean turns to me and said, Karen, this sounds like a new practice model. Yes, that's exactly what it is. And she said, and here was the gift. She said, would you consider partnering with us? Now, why is this important? The College of Nursing at the University of Arizona is one of the top colleges of nursing in the nation.
Yeah.
And to have them, at their request, partner, not financially, but development-wise, was huge. And so for 10 years, I was hand-fed. Advanced teaching techniques, program development, incorporation of more tech in teaching. And I met with the dean every month for 2 to 3 hours. I met weekly with one of the leading RN PhDs there, weekly. And here we are. The program is now 8 months long. It's all online. And we're all over the country. I am starting another class 16, next month. So there we are.
And what are the prerequisites for your program?
Prerequisites is you have to have 5 years of clinical practice, hopefully varied, so you're not just in one area. And you have to fill out a several-page questionnaire, and then you get interviewed by me. And
you interview everyone one-on-one that comes into the program still? Oh,
yeah,
wow. So it doesn't get more hands-on than that.
Yeah, well, I want to meet, and I do turn people away, usually telling them, here's what you need to do and come back and see me in a year. But the people who come to this program are very highly qualified. They're very bright. They are looking for the next way forward. They recognize all the problems, and that's who we want. We want the cream. We're looking for the cream.
What are you looking for? I mean, if you can get even more specific, someone comes and applies and you do that one-on-one, what's something where you might turn them away, or what's something where you're
well,
like, if
they don't know how to write, this is a 3 or 4 page questionnaire, and this is an essay test.
Okay.
And if you don't know how to write, then you're not going to do well in this program. So I send them to the community college to learn how to write. Come back and see me in a year.
Interesting. And why is it so heavy writing? Is that something you do a lot of as an advocate, or what's the intention?
Absolutely. You need to be writing to physicians. You need to write to hospital administrations. You need to be writing to your clients, and we call them clients, not patients, to your clients and to their families. You're writing all the time. Yeah, you have to know how to express your thoughts clearly, concisely.
So such a good point. I'm not an advocate. I'm obviously a supporter, but I never thought of that. That's one of especially in such clinical fields, and there's so many moving parts. The written word is going to be the backbone a lot of that kind of centralizing the information and coordination, it sounds like.
Yes, and then also there are several other things. You have to be a good communicator. You need to understand critical thinking. You need to understand change process, because you're going to be taking your clients through change. And you need to know how to manage that. It can be very frightening for people. You need to be a team player. RN patient advocates put together teams. I'll give you a little tiny story. I took a patient on in January 13. Gentleman had stage 4 very aggressive lung cancer, and typically 2 to 2.5 years lifespan when you get that diagnosis. We kept him going for 8.5 years with quality, where he was still traveling the country, visiting family. How did we do that? The team. RN patient advocates have to know not only how to work with clients and families and docs and hospitals, you have to know how to put together teams and then manage the teams. And with him, it was mainstream onc, radiation oncology, naturopathic oncology, nutrition, several. There were at least eight of us on the team, and we pulled them through for a long time.
That's incredible. I mean, that's where you see there's the black and white difference. It's difference of 2.5 years to 8 years. I mean, of quality living. You can't buy that.
It's not magic. I wish somehow that I could teach people all over the country. Listen, this is possible. Check this out. But I don't have a big enough voice yet.
So interesting. So let's back up a second and talk about, it was interesting when you kind of opened Pandora's box and showed the University of Arizona, that like all this nursing thing, and they said it's a new model of practice. What is the model of practice, if you had to sum it up? Because a lot of people are still trying to wrap their head around what advocacy is, and I think going to you, you're the source to define exactly what it is and how it interacts with the end client.
Our mission statement is to advocate, to educate, and to guide through the healthcare system. An independent RN patient advocate has incredible range of possibilities for working within the healthcare system and in all of those areas: advocacy, education, and guidance. Also, an RN patient advocate can have many different kinds of practice. Some people choose a generalist practice. Some people specialize. There's one specializing just in the grown children of aging parents, another one in cardiac, another one for oncology. I mean, you can build your practice to reflect your own desires, to reflect your own passions. So it's not a one size fits all. It's what do you want to do?
And so that's
you have legal capacity to work all over the United States, pretty much.
So there's the kind of the benefit, well, one of the many benefits to the advocate, right, where they have a wider playing field and they get to choose the type of work that interests and that they're passionate about. That's part of the exciting part about it, right?
Yes, absolutely. There's something called nursing has what is called a compact state. And that means that if you have a license in one of those compact states, you are free to practice virtually or in person in the other 21 or 22 states. So, I mean, I work with clients all over the United States. And
how much of it has become virtual?
A lot of it has become virtual until there's more of us in the United States. I mean, 350 is nice, but it's just a beginning. And there's a gentleman by the name of Bradley Schwartz who has started an organization called Greater National Advocates.
Yeah,
whose mission
that's
is
who's behind this podcast. Yeah.
Yes, and who is an amazing fellow, and he has made it his mission to teach America, you need an advocate, pay attention. And I've been a proud member of that for years. So,
and I'm sure he's excited to have you be a partner. Absolutely. Do you see any emerging issues with the advocacy space that you'd like to see go in a different direction, or do you see any interesting advancements that you think are really exciting for it?
Well, I'll address the first part. The problem, as I see it, and I've been, all the leaders in advocacy, we all know one another, we're in touch all the time. The problem is that there's a great deal of competition in the field of patient advocacy. Pardon me? We all want to do the same thing. Why are we fighting? Why are we competing? Why not help one another? For example, many patient advocates now are not nurses, so they don't have the clinical knowledge base.
Sure.
Why not consult with one of us for a couple of hours? We're not going to take your case over, but we'll make your case a lot better with our clinical knowledge base. And then there are things known as billing advocates. Why not work with one of them to help your clients with their billing issues? You can't be good at everything. Let's work together to make this country safer. I mean, the healthcare system at this point is just a ka-ching. It's all about money. It's not about health. Doctors are leaving the field. Nurses are leaving the field by the thousands. By the end of this decade, the estimate is that there will be a shortage of clinical nurses of 430,000. And we have an aging population. I mean, come on. And so those nurses, we have to catch them. Because if we don't, that's like throwing garbage or gold in the trash. I mean, these are amazing.
What's the reason for the burnout? Why do you think so many nurses leave?
Pay, politics. They are being, they have to work a lot of hours that they hadn't planned on. They have families. They're not getting time off. It's very, very difficult. And what really brought it to a head was the pandemic, when they had much, much greater calls upon their time and expertise, and they just burned out. And, they're leaving the field. People don't want to pay nurses. Who do you think does all the work? Who do you think, if the docs aren't there all the time, who's the eyes, the ears, the brain in the hospital? It's us.
And you mentioned something before we started rolling about nurses being at the forefront throughout history. Tell me a little bit more about that.
Okay. Back in the end of the 19th century, the beginning of the 20th century, from Europe, particularly Western and Northern Europe, we had an influx of millions of immigrants. And they were landing in the tenements in Chicago, in New York, in those big cities. Now, in the tenements, we had very high levels of infant death, diphtheria, cholera. I mean, it was atrocious what was happening. So it was a nurse, thank you. It was a nurse who stood up and created public health nursing. And that was at the turn of the 20th century. And then, traveling a little bit ahead, let's jump all the way to the early 1970s. There were not enough primary docs in the country, and people didn't know what to do, and they were being tossed from pillar to post. And so what did nursing do? Dang, we created nurse practitioners who are now holding a big piece of primary care and doing so very effectively. And then, 10, 12 years later, the healthcare system, the medical system, I'll call it, created something called managed care. What's that? Nobody knew what's that. Nobody knew how to do it. And so what did we do? We created the whole field of case management, RN case managers who could make this work. And now, in the face of all of the trauma that people are experiencing in the healthcare, in the medical system, here we are. This is the next step. This is a long, wonderful history of professional nursing in the United States.
It's so fascinating because if I had to draw a line and connect the dots, what I see as the kind of the thread that goes through here is nurses are at the front line. They see what really the problem is. They see where the needs are. And because of the empathy for the patients, they come up with the solution. And they often spearhead it because nobody else wants to. Would you say that that's a fair assessment of what happens?
Yes. The medical system is about making money, making billions and billions of dollars. They are telling docs what to do and how to do it. They are telling everybody what to do. And it's not about health anymore. So the whole field of patient advocacy is booming and people need to be aware, and there has to be coordination and cooperation within the field of patient advocacy. There's so much that we can do.
And it goes back, I love the way you said, why not get a billing advocate, or why not get someone who's, more qualified on the clinical side. That's about building the team that you were talking about. But now you don't just have to loop in the oncologist, you can loop in other advocates to round out the team.
Yes, absolutely. Why not work together? Everybody needs help, you know? When I mentioned the health literacy being so low, what they found is that, and they repeated the study in 2016, the first one was in '04, and what they found is that people with higher education and more money were more health literate. Really? Not a surprise.
Yeah. Didn't really
But
need
the
a study
fact
for
is,
that.
people don't know. What is a pancreas? What is a thyroid? What do ovaries do? What about the brain? Come on. And so another requirement for patient advocates is you have to be a life learner. You have got to follow exactly what's going on. And in order to help that within the RN patient advocacy community, I've created something called the RN Patient Advocate National Network, where we send out specific articles, mostly about science, to help them in their practice. And then once a month, we do an educational program to help them with their practice.
Kind of like CUs, but just being part of the community almost.
Yeah, yeah. So we need to be bigger. We need more nurses like me out there making change, creating change.
Do you find what are some of the growing pains of someone who's a nurse who wants to become a patient advocate? Do they struggle with the business side of it? Because
Yes.
you are becoming an independent. Yeah.
Nurses are not business people. That's why in the program that we've got going, there's a tremendous amount. We cover marketing, how to do your marketing plan. We have 2 huge modules on starting your business. We have panels from nurses who are doing this. You can talk to them, and we tell them resources within their own community where they can go for free or almost free to help them build their business. We also suggest that they, possibly put together, several RNPAs put together group practices with a business advisor. There are lots of ways around this. Yeah. Is it scary? Yeah. When I began, I had no business experience, zippo. And so I went to the SBA, Small Business Association, and they have located in most community colleges around the country something called SBDC, Small Business Development Center. And I think working with me for a year cost me $45, and they helped me with my first business plan and with marketing and how to make it happen. I mean, there are resources, and we teach a lot of it in the program.
And it's funny. It's like you have that nurse mentality of where's the need, and you've even brought that into the advocacy training program that you developed, because you said, well, I'm not just going to train them how to be good advocates and leave them to fend for themselves. I want these people out in the world doing business, making change, being successful. So you've kind of incorporated that to be a big part of the program.
Now, on something that we haven't talked about yet, and I feel is important to mention.
Yes.
We are also the only program that incorporates not only traditional Western medicine, which we all know, we've been doing it all our lives, but advanced science. What does this mean? Globally, for at least 15 years or more, there has been a resurgence of research into the body and how everything is connected. It's called systems biology, and it demonstrates and teaches how everything is connected. Now, in medical school, they're taught to be specialists in this and specialists in that. And, they look at one part of the body and they don't talk to the guy looking at another part of the body. That's not helpful. You need to understand that everything is connected. Now, there are physicians called functional physicians who practice this way. One other thing that they do that is a real standout, they go after root cause. Well, what's root cause? Well, all right, so you have Parkinson's. Pardon me, miss. Why do you have Parkinson's? Is it connected to your gut? Can we do something about your gut? If you understand root cause, And systems biology teaches us this. If you understand root cause, what can you do?
You can treat the root.
Yes. Like, for example, when somebody gets a diagnosis of cancer, rather than the first thing is, well, here's what we're going to do to treat it. How about, why do you have cancer? For example, in non-solid tumors like lymphomas, they're almost always tied to toxins. Why not find out what toxins are in your body that is promoting this and get rid of them? Because there are ways to get those toxins out of your body. Oh, it's so cool. There are so many connections in your body if you understand that. Another thing to understand is there's something, and I'm sure, John, that you have heard of this, called the microbiome.
Sure.
All right. The microbiome, and you have 8 of them in your body, or 7. And even on your eyeballs, you have 8 types of bacteria. You've got your own microbiome on your eyeballs. The biggest one, of course, is in your small intestine. And if you do not have a properly functioning microbiome in your gut, that will affect your immune system, it will affect your brain, it will affect so many factors in your body. But there's a way to figure that out and fix it. Another thing that you need to be very much aware of is inflammation. Am I getting too clinical here?
No, I'm fascinated. That's why I'm being quiet.
Okay. Inflammation is a 2-part, and it's based on your adrenals. And when you are injured, it steps forward and it sends out inflammation to heal the immediate need. However, that's about this much of inflammation. Inflammation is the root cause of every single chronic disease we have, and in fact, is the leading cause of death. Now, what can you do about this? Well, how about we figure out what your level of inflammation is? And there are a lot of lab tests that do this, many of which are already covered by insurance. Find out. And then there are many ways to address the level of inflammation, starting at the cell wall level, going full bore through your whole body.
I suffer from gout, so I'm just taking
gout
mental
is
notes.
related to diet, my friend, and if you want to talk about that, give me a call separately. Gout is related to your diet.
I've heard that. Another time I'll give you a call. But yeah, I've heard also there's an inflammation component to it, so that's why.
Absolutely. You can turn that around. I mean, these are fixable things, but you have to know. And for example, people ask me questions about all kinds of stuff, which I love. And if I don't know, I'll tell you. And then I know how to go about finding accurate scientific information. In fact, one of the modules in our program is called data mining. Where do you go for accurate scientific information? And there's a whole stream of places that you go, and it doesn't include WebMD, and it doesn't include Dr. Google.
I think what's an interesting point that we can make there is, once you become a trusted advocate for a client, they're probably going to turn to you for just about anything, right? Because you become almost the first line of defense of, well, let me call my advocate before I kind of run around in circles at the hospital. So being able to find and source the quality information that can get you on the right path, it becomes integral as a skill set for an advocate. Is that right?
Absolutely. And you mentioned something. It is our responsibility also, because we're not going to be with them forever, to teach them a lot of how to advocate for themselves. In fact, one of the things that we do, and I started doing many, many years ago, is go out in the community and teach people. And, I do this for free. We all do this for free. You go out and teach people why and how to be your own health advocate. What the heck is gluten? I mean, how do you deal with cancer? What are your possibilities? Go out and teach. People need this information, and they need to know how to take care of themselves after you're gone. And that's our responsibility also.
I think the buzzword that I've heard so much in the culture today that kind of sums up some of the approach is this holistic, treating the whole person. Would you say that I know that sometimes it feels a little too, airy-fairy to say holistic, but there's a root there of the idea of treating the whole person that really does have a lot of validity to it.
Well, it's a very interesting word you'd picked, holistic. I tend not to use it because it means about 100 different things to different people.
Right.
And so words, semantics are very important. Integrative medicine, which is a wonderful, type of medicine, what that means by holistic is different than what nutritionists call holistic. And you just have to be aware who's talking and what do they mean.
I think that's a good point. So it's not a useful term because it has so many different definitions.
Right.
Interesting. Right. If you could, other than awareness, right, what would your if I can give you a magic wand and say you can change one thing about the future of advocacy, what would it be?
Pulling more qualified, experienced clinical nurses into the field and giving them all the tools to go out there and make change and help people. People are dying. I mean, I'm serious. 12 million misdiagnoses. Are you serious? And you know what? There's a reason for that. And when you read the executive summary of that study, it says what the problem is. Want to take a guess what it is? Go ahead.
I don't want to. Go. You just tell me the answer.
Okay. The answer is information. Medical records are scattered all over the place. We've got electronic health records, and we got a few different kinds of that, and we've got written records, and we've got hospital records. And the reason for the misdiagnoses is the prescribing physician does not have accurate, scientific information about that patient sitting in front of her or him. And so what we did as RN patient advocates is we created something called the Medikey. And the Medikey is a direct address, and it provides all the information. Docs can't imagine. They're blown away when they see a Medikey. I mean, they sit there and they're reading through this.
Are you saying Medikit with a T at the end?
Medikey. Medikey. And we teach nurses how to do this. It's an amazing tool, and it stops misdiagnosis in its tracks. I mean, nurses are pretty amazing.
I've heard this analogy before, but an advocate almost acts as quarterback, right, between all the teams to make sure that everybody's on that same page.
Right.
That's brilliant. There has to be a lot of clinical experience to kind of get an IR. Is it iRNPA? Is that the designation?
Yes, small I for independent, and then capital letters RNPA.
So you have to be a lifelong learner. You have to have a little bit of an adventurous spirit to kind of go into business for yourself. You're probably burned out a little bit, right? As are most nurses, it sounds like. Are there any other qualities that you think make a great advocate that I haven't listed?
The ability to communicate clearly to many, many different types of people in organizations. The ability to build teams and manage them. The ability to help your clients and their families manage change. The ability to, you mentioned being a life learner. It has to be part of your practice to do something called critical thinking. Critical thinking means you take in all this information, what's garbage, what's not, and how do you make that decision? You have to know how to do that. It's got to be part of your active daily practice. I mean, those are just, some of the big things, and you have to be excited about what you're doing. If you're passionate about patient advocacy, then this is for you. If you're not, then stay where you are, or possibly become a coach. Yeah, There are two major coaching organizations in the country. there are possibilities to catch these nurses. If they want to do coaching, there's Linda Bark. And there's a woman by the name of Lynn McCright down in Texas. They can become coaches. I personally feel very, very strongly that we need many, many more independent RNPAs because of the changes we make in our community, the changes we make for our clients. I mean, I could go on and tell you stories till tomorrow, but, obviously we don't have time to do that.
Well, I mean, I can't thank you enough for sharing all your wisdom and the vision of everything that you've put in place. If someone is interested who's listening, who's a nurse, what's the best way to kind of learn more about your program?
Okay, go to iRNPatientAdvocates.com. Plural on the advocates, iRNPatientAdvocates.com. That'll tell you what's in the program. It'll tell you about the network. It'll tell you how to apply. It'll tell you everything you want to know about this program. And also give you a way that you can apply. And you can also just email. And all those emails come to me and my team. So, you want to find out more, that's how.
Thank you so much. Karen Mercereau, you are a guiding light. Thank you for being on the program.
Oh, thank you for this opportunity, John.